Good morning, everyone. My name is Judy Blake, and I am the Leadership and Advocacy Coordinator for Family to Family Network in Houston, Texas. Thank you so much for joining us today, Wednesday, February 3rd. We are very, very happy to have our presenter today, who I will be introducing in just a moment. First, I'd like to introduce my amazing, incredible colleague, Christina Zavala.
Hello, welcome everybody. Thank you, Judy.
I could not do my job without her. She is one of the kindest people I know on the planet. She's bilingual. In my next life, I will be bilingual. And I am just so grateful to be able to work with her. I also want to tell you, we have another one of my colleagues on this call. I don't know if she's going to show her face. Oh, there she is. That's Leslie Lawson. She is raising her hand. So Leslie, if you do not know, Leslie is an amazing, amazing parent liaison. So she has been doing this, let's just say for a long time, because we never want to give away somebody's age, but she has been doing this for a long time. She is so knowledgeable, very dedicated, passionate to helping our families and to making sure that they understand what their rights are. So I'm so thrilled to have two of my colleagues on today. So what I'd like to do is let you know that we will be taking questions after the presenter is finished. Please write them in the chat box. And you can write the question to everyone. But if you're not sure about your question, and if you just want to send it privately to Christina or myself, feel free to do that, and we can ask it on your behalf. Some people like to remain anonymous, and that's okay with us. Just remember that this is a safe space. Every question is important and no question is silly. So if there's something that you're not understanding that our presenter is mentioning to you, just jot it down and say, you know what, can you explain that again? Or private message Christina or myself and say, I am totally lost and did not understand that. Because it's possible that somebody else didn't understand it either. So we will make sure that we address all our questions. If you need to leave for some reason and then want to come back, no problem. We can let you back in the room. Thank you so much for being with us. So I want to present, and I must tell you, I'm very excited to say this. He recently got her PhD, Go Ninfa, Dr. Ninfa Escobar. I've met so many people these last several years, and I must tell you, if there is someone who is one of my go-to people, Ninfa Escobar falls into that category. She is dedicated, so intelligent, and if she doesn't know the answer, she's honest enough to say, you know what, I'm not really sure. Let's check with someone else, or let me get back to you on that. She truly understands the challenges of our families, and she is such an amazing representative of the Harris Center for Mental Health and IDD. So I'm going to go ahead and have her share her screen and present for us. And Ninfa Escobar, my sister from another mister, thank you so much for joining us today. Can't you see the resemblance?
Thank you, Judy. If you guys will bear with me just 1 second. Zoom is not something I use super often. So
what you want to do at the bottom is just, if you do share screen and then bring up your PowerPoint, there you go. And you can do slideshow.
There we are.
There you go. There you go, Ninfa.
Awesome.
That PhD degree really paid off.
Yeah, right.
Thank you, Ninfa.
So thank you everybody for having me today. I especially want to thank Judy for reaching out, and obviously you guys know Judy, but if you don't know her that well, she is someone that always makes you feel good about what you do. It's one thing to say that we're in a safe space, but it's another thing to actually feel that. So thank you, Judy, for the warm welcome and for having me here today. So I am Ninfa Escobar, as Judy has mentioned. I have been working with IDD services for almost 15 years in November. almost 14 years in November. And if you're curious, yes, I graduated college when I was 15 and I got in the field. So IDD, I think different people can speak to how they ended up where they are. But really it was just, happenstance at that time. They were looking for a bilingual service coordinator. And I happened to pass the bilingual test after the second try, of course. And that really just started my career in IDD services. So since 2007, I've been in this field. I did move out of state for 1 year. And again, I think that you are always where you're intended to be. When I moved to rural Ohio, I became a service coordinator there. So really random. They don't have openings and they had it when I went down there. So it was an incredibly amazing experience in Ohio, and just understanding their services. But it just re-energized me to come back to Texas and kind of pursue the role that I'm currently in. So the presentation that I have for you guys today, and I'm gonna move you guys to the top so that I could see, okay, is about IDD services. I will touch a little bit on mental health services at the end, but my primary area of expertise is IDD. So we're going to talk about access, eligibility, and beyond. And just before I get started, Judy, can you give me a heads up or thumbs up? Volume okay? We're good? All right. Good deal. Okay. All right, so we have 4 goals today that I would like us to accomplish. We want you to understand how to access IDD services and supports at the Harris Center. We want you to have an awareness of what those services looks like. We want to have a small discussion about long-term services and supports for IDD. And then, like I mentioned, we do want to discuss where to locate mental health services information from the Harris Center. So, what is a LIDA? I want to jump right into the language that is used with IDD services. If you ever go to the Health and Human Services website, you will see a lot of acronyms. We're all in this field, right? So we have all a million of them. But one of the important ones is a LIDA. You'll see LIDA referenced quite often. And so what is a LIDA? So the LIDA is the point of entry for publicly funded intellectual and developmental programs. So we are the folks that the Health and Human Services Commission works with so that we can provide services in the community. We are responsible for providing and contracting for the provision of IDD services and supports. And then we're also responsible for enrolling individuals into the following Medicaid programs. So we enroll individuals into what we call intermediate care facilities, or ICFs. And then we also enroll them into the state supported living center residential placement programs. Other enrollments that we do is home and community-based services, HCS, and Texas Home Living. So what I want you to take from this slide is the Harris Center is the LIDA for Harris County. So again, you ever go to the Health and Human Services Commission, it says reach out to your LIDA. Your LIDA is the Harris Center. Okay, I'm gonna have to move you guys a little bit because I can't see my title. Okay.
Your title is the point of entry IDD.
Yes, but how do I? Oh, there we go. Okay. So the point of entry for IDD, the main thing is that you have to call the Harris Center Patient Access Line, 713-970-7000 option 2. That starts the entire process. So when you call, you will either speak with somebody or you'll leave a voicemail, and you'll want to say that you're interested in IDD services. A consumer services coordinator will call you back and they'll talk about the documents that you're going to need to start this process. So I listed just a couple of documents. This is not an exhaustive list, but just so that you kind of know ahead of time, if your loved one is wanting to access IDD services at the Harris Center, we are going to need records so that we can substantiate the eligibility. as we look through the diagnosis. So we'll need FIEs, we'll need official transcript, copies of evaluations, including any that have been done privately. And again, we have to be able to have evidence to determine that someone has an diagnostic that meets diagnostic criteria for our services. So the eligibility determination process here at the Harris Center, specific to IDD, the Eligibility Center is located at 9401 Southwest Freeway. This is important to know because eligibility for mental health services is located at the specific clinics in the community. So just wanted to point that out. When you speak to somebody, they will reiterate this information, but sometimes we get that question a lot. Well, there's a Harris Center down the street. Can I go there? Or, you know, my friend goes here, can I go there? So specific to IDD, we do have one designated eligibility center, which is at our Southwest main location. Towards the bottom of the screen, you'll see that the eligibility determination process, again, for IDD services includes 3 parts. It has a financial eligibility assessment, a diagnostic eligibility assessment, and an intake review. I want to take a second just to look a little closer at this process. So the financial eligibility assessment that happens when you come in for services is that you will meet with a financial counselor to explain the Harris Center financial policies and to determine if copays or other fees apply. We do utilize a monthly ability to pay scale that is provided to us by the Health and Human Services Commission. More often than not, the services that we offer, families do not have to come out of pocket for. But again, there is a formula and there is additional information when you come in to further explain if you do have to pay a fee, what that fee looks like and how you will pay that. The second part, again, of the process is the diagnostic part. So we complete what we call a DID, the determination of intellectual disability. It is performed by a licensed psychologist or an authorized DID provider certified by the Health and Human Services Commission. I also wanted to take a point to indicate that because we have families that say, well, I already have something that says that my loved one has an intellectual disability. That's perfect. That's great. We're going to need that information. But ultimately, in order to qualify for the IDD services, we have to go through this process through our licensed psychologist or DID certified provider. The last part is an intake interview with an eligibility coordinator to explain consumer rights, some of the programs we offer, what their needs look like. They complete what we call a service coordination assessment. And that does a great job of highlighting what are the needs of the family so that when we move to the next step, we kind of have a heads up of what the interest is and need. I also want to point out for the intake interview, if you have an advocate that is assisting you in this process, like Judy or others that are on the call, you want to make sure that the family completes a disclosure with your information on it so that we have the permission to share information on the case. This is incredibly important, and I think Judy could probably talk an hour about how important this is, but I do want to highlight that. Again, if you're working with a family, let them know, hey, make sure that, you know, I have permission in the form of our written document here at the Harris Center that they can speak to me. Judy knows the system a lot better, and as I'm sure some of you advocates do as well. And so having that on file will make it a lot simpler for me to be able to say, it's pending assignment, or we haven't received it yet, or whatever that update is. So who can get help? So to access services, one of the following must apply. So this slide here is generic because I understand that there might be some people on the call that are not Harris County. So in general, to qualify for IDD services, the individual has to have a diagnosis of an intellectual disability or a pervasive developmental disorder such as autism, and or a related condition to be eligible for enroll in an HHSC program that serves people with IDD. Here at the Harris Center, if you are eligible for services, this case will be referred to the Service Coordination Department for the assignment of a service coordinator. So just briefly to recap, we've gone through the eligibility process. Again, there was 3 components there. And if you are eligible, it will then next go to service coordination. So how can a service coordinator help? A service coordinator can do 3 main things. Of course, they do a myriad of other tasks, but they serve as advocates for individuals. They make sure that when we take on a case and we develop what we call a person-directed plan, that plan is reflective of what the individual wants. What do they want to accomplish? What supports do they need? In addition to the advocacy, they also support our individuals. You know, that they understand that it's the right of each individual to make decisions based on informed choice and their goals and values. So if an individual wants to find a job, we will be happy to support that. We'll work with them to determine what are the best resources to connect them with to make that happen. Which goes into my 3rd point, the connection piece. So we have services here at the Harris Center that we'll talk about that the service coordinator can connect you to. But if we don't have the services that you're seeking for available, it is the role of the service coordinator to assist you in finding that resource in the community. So again, we advocate, support, and connect. These are some of the IDD services and supports here at the Harris Center. So we are going to go into each of them so that you have a better idea of what that service actually looks like. We have in-home respite, day hab, behavioral services, specialized therapies, community behavioral supports, employment assistance, community first choice, feeding clinic, coffee house, and espresso. So this is kind of a high level, just kind of quick overview on each service, right? We know what the service is, but sometimes it's not very clear what it looks like. So in-home respite services are intended to provide the primary caregiver with a break. Here at the Harris Center, once somebody is in service coordination and identifies this as a need, we can then authorize 24 hours. I say here at the Harris Center because every LIDA is different in how they utilize the funding that they receive from the Health and Human Services Commission. So here at the Harris Center, we've determined that 24 hours per month allows the families to receive a break and also allows us to serve numerous families so that everybody can get, not everybody, so that we have a large amount of individuals that are accessing this service. We do have an option where families can choose their own provider. The provider can't live in the family home and they have to be a certain age and pass a criminal background check, but there is that option to select your own provider. And then we also have a contract with an outside agency that they can also provide providers if you don't know of anybody that would do that service. A couple of things to note about in-home respite here at the Harris Center. I didn't include this in the presentation because it's ever evolving. So I just wanted you to at least know what this service was. But currently there is a small wait list for this service here at the Harris Center. We have about 100 families waiting to receive this service. But once you come through eligibility and you're attached to a service coordinator, they'll ensure that you are placed on the wait list for this service. Okay. We also have day habilitation. Day habilitation is intended to provide daily structured activity, more often when someone has graduated from high school. While the individual is at the day hab, they work on their desired goals. We do have some added value services here with DayHab at the Harris Center. We partner with Bloom Fitness, and we have been providing some spin classes to our individuals in DayHab. And now that with COVID, we are virtual, so we have been doing some virtual fitness classes as well. The Harris Center has 3 locations for the day habilitation program. So we have one located off Gessner, we have one in Humble, and then we have one in Pasadena. So when I send this presentation, I'll attach the brochure so that you have those locations. But again, the key to getting this service is to go through the eligibility process, have a service coordinator so that we can authorize this service on the plan. One other thing I want to mention about DayHab, we do not provide transportation, and there is an exclusionary list for attending, which I will send with the presentation as well. We have behavioral support services that we offer. It is intended to address behavioral services or behaviors such as spitting, hitting, yelling, biting, noncompliance. The team is comprised of a board certified behavioral analyst and an ABA specialist. So we do use the applied behavioral analysis methodology here with our services. There is a wait list for this service. But again, your key is having a service coordinator that will place you on this wait list so that when those services do become available, you are notified. Pre-COVID, we would have the intake here at the Harris Center, and then the sessions would be out in the community with the families. Currently, the service is 100% virtual and will be that way at least for the foreseeable future. One thing I do want to add is that these ABA services, behavioral support services, is a partnership with the parents. So it's not that the individuals only receive the services and they improve. It's that we work with the parents to help in implementing the strategies that are being taught, because our ABA staff will not be there 24 hours, right? The parent will be. So it is a partnership. And so we do request involvement from the parents in order to maintain these services. Specialized therapies is another service that we offer. It is intended to address anger management, depression, self-help skills, bullying. It is considered counseling or talk therapy. So for individuals to receive this service, they do have to be able to verbalize so that they can participate in the service. Of course, if there's somebody that is pre-verbal or maybe, might be able to share some things verbally, our team is always willing to staff those cases for appropriateness. So again, your key here, again, continues to be the service coordinator, letting them know that you want this service and for them to, again, serve as an advocate in getting the service if there's any concerns that the eligibility criteria will not be met. Of course, the service coordinator will review these services with the families, but this is a way for you to also know what you can ask for. Currently, there is, again, a small wait list for this service. One of our therapists that we've had on the team for numerous years has retired. And so we're in the process of backfilling her position so that we can resume referrals to that program. Okay, community behavioral services. This is known as the CBS team. It is comprised, again, of a board certified behavioral analyst, an ABA specialist, and a nurse. The unique part about this team is that they are more crisis-based, if you will. So they want to go out there to do an intake to make sure that we know everything that's going on with the individual and then provide some type of intervention. These services are not intended to be long-term. They are just intended to kind of address what is currently going on until we can get them into more permanent services like the behavioral support services that I mentioned in the previous slides. while the Harris Center has a crisis line that people can call if there's a crisis, this team, in terms of staying involved short term, there is, again, a small wait list. But your service coordinator, again, is your point of contact to make sure you are on the list to wait for the service if it's needed. The next program is Espresso. This is a really cool program. It is designed to help individuals learn how to participate in society while in high school. The program assists with increasing vocational skills, job readiness, and socialization skills. Due to COVID, it is entirely virtual. From my understanding and speaking with my service coordinator and with the clinicians involved in this program, they do a lot of group talk and conversation, a lot of processing. They watch the show from Netflix, Atypical, which is super awesome, cute show, to kind of explore the social situations that sometimes our individuals face, and to kind of process some strategies on how to navigate that in the real world. So it's a really cool program. And again, the service coordinator would authorize this service on the plan. There is no wait list. So if you were to go through our eligibility department, get a service coordinator, you can ask for this service, and then we can authorize, send the referral, and get you into services, or get your loved one into services. We have employment assistance. So this is designed to help individuals to locate full or part-time paid competitive employment of their choice. We assist in locating employment and assist in applying to jobs or practicing interviewing. So we do have a few locations where we do this. We have an Humble location that provides this service, and then also our Pasadena location. Due to COVID, we are 100% virtual with this service. We actually have some really exciting news regarding the employment assistance services that we provide here at the Harris Center. So at the Harris Center, we have a foundation, and that foundation this year asked for grants and ideas on how they can support the agency's mission, which is to transform lives. So Lily Pan, she is the Department Director of Habilitation, submitted a proposal to develop a coffee cart service here at 9401. And it was approved. So she received funding to start this mini business, if you will. And so the individuals that will run part of this business will be in our employment assistance services. So we're really excited about not just the provision of employment assistance, but to actually have an active role in them obtaining a job, understanding what it is to serve others, and that whole process. So we're really excited about that opportunity for our individuals. It's called Capable Coffee. I don't know if I said that, but we're really excited about it. Community First Choice is another program that we oversee here. It is a Medicaid entitlement program. And so what that means is that if you go through our eligibility department and you qualify for the program, you are entitled to receive it. And so we have a specific CFC service coordination team that helps in the enrollment of that program. Of course, all programs require for there to be a need. So it does need to be somebody that needs assistance with either daily living or learning how to complete a task. It has two main services, which is personal assistance and habilitation. And so the personal assistance is, again, to help with daily living. And the habilitation part is in learning a new skill. Maybe your loved one wants to learn how to wash dishes or load the laundry. Those are things that could be written into this plan, and then those services can be provided through that program. One thing I want to note is that it's not exclusive for individuals with an intellectual disability. So again, you can have a developmental disability, and there are also some related conditions that could qualify you for Community First Choice. If if you are so they identify minors a little different. If you are 21 and below, you can actually reach out to your managed care organization to ask for community first choice. That is another way to start that process. Okay. The feeding clinic is another program that we have here. It is designed to help individuals that struggle with food and or liquid refusal, texture, or type selectivity. So these sometimes are the things that we see in our autism individuals. The feeding clinic is really neat and it's really unique. There are not a lot of services like this out in the community, and so we're really excited to offer this here. Of course, there is some exclusionary criteria. They want to make sure that the feeding issues are not related to something medical before services start. So there are some things that you kind of have to submit and go through before actually receiving this program. How this works, again, once you have a service coordinator, you can indicate that you are interested in the feeding clinic. We will send a referral so that they can start the process to ensure that the individual does meet the requirements for the program. Again, when I send this presentation to Judy, I will be sure to include that brochure that has a lot more details about the program. The coffee house program. This one I feel like is one of our more well-known programs. It is designed to help individuals learn how to participate in society after they graduated high school. So if you remember, we talked about espresso just a little while ago. The coffee house program is a version of that, but for those that have actually graduated high school. So the program manager that oversees this program, if you see the connection, it's coffee house and espresso. They're similar programs, and then they just target different ages. It is designed as a drop-in with mandatory participation once a month. So it's designed as a drop-in because we want to increase the autonomy of the individuals that are receiving these services. But we do ask that, again, they attend once a month to remain enrolled in the program. Pre-COVID, the coffee house program would do numerous things. They would take field trips. They would have a lot of group discussion, really anything that could help them in learning how to better participate in society and kind of address some of their stress and anxiety that they feel in certain social situations. This program is also virtual at this time. So, and there is no wait list. So again, if you have a service coordinator and there's an interest in this program, please let them know so that they can work with you to authorize it on the plan and to send the referral. All right, so let me back up. Okay, so the coffee house program is the last program or services here at the Harris Center. And now I want to move into long-term services and supports. So again, when you're looking online on the Health and Human Services Commission website, there's a lot of information out there. There's a lot of different long-term services and supports, but these two that I'm highlighting here are specific to the IDD population. Of course, there are other waiver programs where there's an overlap when somebody can have ID and another diagnosis, but these are specific to IDD. So we have the Texas Home Living Waiver, and we're going to go into a little bit more detail in just a few slides. And then we have the Home and Community-Based Services Waiver. These are the main two IDD waivers for our population. They are intended to ensure integrated community living. So Texas Home Living is a Medicaid waiver program. So that does mean that you have to qualify for Medicaid in order to get this program. There is currently an interest list for the program. and we'll talk about how to get on the interest list in a few slides, but there are a lot of people in both Harris County and the state of Texas that are on this wait list. I don't have the exact numbers, but I do have them for the next waiver, and I'll provide that information. For this particular waiver, they do have to have an intellectual disability or related condition to qualify, and the individuals must remain in the home in order to receive this waiver. These are just some of the Texas Home Living Services. It's not inclusive of everything, but just to kind of give you an idea of things that it offers, you might draw a correlation that some of them are similar to what the Harris Center offers. The biggest difference is just that when you are in a waiver, such as the Texas Home Living waiver, it's more robust. You have more opportunity to access services through the waivers than you do through just the Harris Center alone. And actually, let me back up 1 second. For the Texas Home Living waiver, I do apologize. I made myself a note. For the Texas Home Living waiver, as I mentioned, there is an interest list. It continues to remain the priority of HHSC to address the interest list. And so after several years, last week, we were notified that the budgeting forecasting staff with HHSC has determined that there's enough funding for 400 Texas Home Living waiver slots through the end of FY 2021. So that ends in August. So what does that mean for the Harris Center? Well, when they release interest list slots, they release them for the entire state. So we will be getting 58 out of the 400 slots will come here to the Harris Center. When we receive those slots, we reach out to the family to let them know that they now have a waiver slot, and then we talk them through that process.
Ninfa?
Yes.
Debbie, you raised your hand. We were asking people to hold questions until the end. Is it a quick question, or would you like to type it in the chat box? Debbie?
Hello?
Hi.
Hi. Yes, it was an accident. I'm sorry. I
Oh,
didn't
no
mean to raise
worries
it.
at all. No worries
Okay.
at all. Thank you.
Okay. Sorry.
All right.
Mhm.
Oh, you're fine. So I wanted to provide that happy update because, like I said, after several years of not receiving any slots for people to enroll into Texas Home Living, we now have an opportunity to at least enroll about 58 individuals through the end of this fiscal year. Okay, so home and community-based services, HCS, this is one of the bigger Medicaid waiver programs. Similar to Texas Home Living, it is funded by Medicaid, and so an individual does have to have Medicaid in order to receive these services. There is currently an interest list for the program. So in the last update that I received a few months ago, there was over 100,000 people on the wait list for this program statewide. Here in Harris County, we have about 19,000 people that are on the list and waiting for this program. HHSC continues to maintain it a priority to reduce the interest list. It continues to come up in most legislative sessions as they work to request funding to release additional slots. So for perspective, for FY 2021, which started in September of 2020 through August, statewide, they're releasing 3,400 slots, and the Harris Center is getting 461 of those slots. So how it works is they release them on a monthly basis to the different LIDAs, And then once we receive them, we contact the family. So yesterday, we received an additional 64, and we will continue to receive them monthly until we reach that 461 number. For additional perspective, the people that are receiving an HCS slot at this time were originally placed on our HCS interest list in May of 2006. So people are waiting several years for this waiver. And I'm going to go into my soapbox in a little bit, but it is so important that if you work with somebody that has IDD, you know somebody that has IDD, that you make them aware of this list. And we'll talk about how you do that and how you get on this list in a few slides. So if you're not sure why people wait 15 years, about 15 years for this slot, is because it has a residential component. So what that means is that individuals that receive an HCS slot can choose from 4 different residential models. They can continue to live in their home with all of the services and supports that they need, or they can have a group home option where they can live in a home with no more than 3 other individuals. So kind of college living, if you will. That's one of the things with HCS, is that there can be no more than 4 people to a home. Once you receive the program, you have the program for life, and you know your loved one will not have to worry about if they're getting what they need to remain in an integrated community setting. Again, this is not an exhaustive list, but this kind of gives you some idea of what are the services that they can receive through HCS. Again, the main thing here is the residential services, which the Texas Home Living waiver that we talked about does not have that component. Okay, so how to access HCS and Texas Home Living. You must be placed on the interest list by the LIDA. So we talked about who's a LIDA. So the Harris Center is a LIDA. And so if you're on this call and you're not from Harris County, we'll talk a little bit about how you can figure out who your LIDA is. Each program is a different interest list. And so you'll want to make sure that when you call to get on this list that you're on both. You're on Texas Home Living and HCS. An offer of these programs depends on one's date of placement. So I talked a little bit about when they release slots, they release them statewide. So if you wait even a day, that can mean several months from the time somebody that got it was on the list the day before to you. So it's really important that you get on the list as soon as possible. Don't delay it. There is no diagnostic criteria for getting on the list. So I tell parents and families, you know, maybe you're not sure. Maybe you haven't received an official diagnosis, but there's a suspicion. You know, I would recommend that you just get on the wait list. To be placed on the HCS and Texas Home Living interest list in Harris County, you will need to call the Harris Center Patient Access Line at 713-970-7000, option 2. You'll want to indicate that you want your loved one to be placed on the HCS and Texas Home Living interest list. Okay, this is my soapbox. So now that you have received this information, you are responsible for bringing this awareness to others. We continue to get individuals that come for services and they're 21, 22 years old, and they were never placed on this wait list. So somewhere along the line, we're still not being very effective in alerting families that it is vital to get on these wait lists. So again, you have a responsibility, not just as a professional working in this field, but as a person. I've had numerous occasions when I was just having a conversation with someone, and they mentioned their loved one being in special education or something that triggered me to be like, are you on the wait list? So I've had a few times when they were like, yeah. And I'm like, well, can you double check? Can you double check and make sure you're on the wait list? Only to find out that they weren't. So that made an impact in that person's life. They may not feel it now, but in about 15 years, they will be so thankful that somebody told them to get on the wait list. So again, now we all share this responsibility. So please, use it wisely. And, if they don't need it, they don't need it. But at least you were able to share this message. Okay, so if we have anybody on the line that is not from Harris County, this is how you find your designated LIDA. The link is at the bottom, but you can, so you can go to the link and then you'll be able to put in your zip code and it will tell you who your LIDA is so that you can reach out to them to commence services. Okay. So we've talked about IDD services, and I wanted to make sure that if nothing else, I mentioned a little bit about our mental health services here at the Harris Center. So the services that we offer are broken down into the mental health services that we offer are broken down into 4 categories. So we have outpatient mental health services, which are the clinics that are out in the community. We have comprehensive psychiatric emergency program, which is housed in NPC and HCPC. We have forensic mental health services where we work with individuals that are in the juvenile justice or in the justice system. And then we also have the Harris County Mental Health Jail Diversion Program. It's a program started several years ago as a way to divert individuals from going to jail and instead offer services and supports to prevent incarceration. For specific information on our mental health services, I do want to direct you to our website. So www.theharriscenter.org. We have added an awesome little chat box at the bottom right corner of your screen. So as soon as you go to our website, doesn't matter what page, this little chat box will appear. And it's a person. So you can actually have a conversation and really kind of ask the questions that you'd like to ask. If they don't know, they will do some research and get back with you. So I highly, highly recommend it. For transparency, I use it myself. The Harris Center has a ton of services and supports. And so it's not always easy keeping track of everything. So I also use it, when I need some additional assistance or support to get somebody to the right place. So I do encourage you to go to our website, explore it, kind of see what we have to offer. And then I also wanted to highlight the COVID-19 support line and resources. So we do have a toll-free 24/7 support line that anybody can call. It is a statewide COVID-19 mental health support line that was launched by Texas Health and Human Services. We offer trauma-informed support and psychological first aid to those experiencing stress due to our current pandemic. The Harris Center definitely wants to be here to support your needs, but more than that, support your needs during these challenging times. So please make sure you write this information down. Again, you are now responsible for sharing this information in case you come across somebody that really needs some support. We are here to help. If you are interested in receiving information or services from the Harris Center, your go-to is going to be our 713-970-7000 number, option 2. And you can do a variety of different things. If you are interested in a mental health clinic, you can call them, let them know where you live, and they will let you know what clinic is closest to you. They will provide you with information that you'll need in order to qualify for services. And so that's going to be your main contact to start any type of services here at the Harris Center. I would recommend that you call it before you go to any of our sites, just to make sure that you have what you need in place in order to access services. We also have a 24-hour crisis line. So if you need immediate assistance for a mental health and or intellectual and developmental disability related crisis, or if you are a current client and you have an after hours medication concern, that was intended to say medication, not mediation concern, please call again our 713-970-7000, but you want to choose option 1. That will get you over to a crisis counselor that will be able to triage the situation and get individuals involved as needed. Just from my experience, when our individuals call the crisis line, we get an email, and so that we can follow up and figure out how it is that we can support. So we do work closely together to triage those helpline calls. And let's see. All right, so what questions do you have?
Oh, Ninfa. Lots of great questions. What's that?
I said I'm under 3 minutes. I didn't know if I needed to be done before 1.
No, you're okay. And for those of you who do have to leave us, because we realize everyone is on a timetable these days, if you have to leave us, please make sure that you fill out the survey link, which Christina has posted. And I'm going to go ahead and post again. Let me copy and paste that. So, and then we're going to get to, oh, thank you, Christina, for doing that. So Christina has posted the survey link. Please make sure that you complete that. We want to know where we can improve, and your opinion does matter. In 2 weeks, we will be having Kim Torres from the Houston Airport System join us. And I've included that flyer as well, and I will be emailing information about that. If you would like a recording of this link, please email me, send us a message in the chat box if you would like a recording. So Ninfa, a lot of information, so much information, almost like we could have done this over 3 training sessions, because there is so much that the Harris Center does. But I
tried to condense as much as I could to make it worth everybody's time.
Yes, no, it was great. It's just there's a lot of information, and there's so many little variables, if you will, for each family. So it was really challenging. So what I'm going to do is, I believe I have everyone on the list, and I will just automatically send you the recording. And if for some reason you haven't gotten the recording in a couple of days, please email me and say, Judy, I never got the recording, so I can make sure that you get it. Okay, so I'm going to go from the bottom up, because that will help me make sure I get everyone. So Lorena asked, got to put on the reading glasses for this one. Thank you so much for the presentation. It was very helpful. Oh, she wants a recording. Okay. When they do their yearly check, whoops, does it automatically disqualify your child if you move out of Harris County?
Okay. Thank you, Lorena, for that question. So I'm assuming that you're speaking about the interestless check-in that's done. So we do the interestless check-in on a biannual basis. So it's statewide. So even if you do move out of Harris County, as long as you remain in Texas, you will remain on that interestless. When they call you or you call in to provide your updated information, again, just make sure you provide your best contact information so that we or another LIDA can make sure that they complete that biannual contact so that you can remain on the interest list.
Thank you so much. Next question. Okay. Okay, so Leslie had asked, for HCS, they do not look at the family's income, only the child's regardless of age. For Texas home living, they do look at the family income if the child is under 18, I believe. Is that correct?
Those are nuances to the program.
Okay.
So what I can do is, Judy, if you send me that in writing,
Yep.
we have a Texas Home Living Program Director that can speak specifically to those
Perfect.
requirements. I do want to say though, for HCS, okay.
That's
I'll
okay.
put it-
Why don't we
okay,
do
I'll
this?
put
Because
it
we
in
have lots of
writing.
questions.
Yeah,
Don't you worry.
It's a little confusing, and so with
Welcome to the world of waivers. Yeah, don't you worry. Christina, could you copy and paste that and let's start an email of things that we need to follow up on?
Sure thing.
And then,
Thank you.
Thank you, Christina. So, okay, I was told that a good practice to put a recurrence on my calendar on my child's birthday to check every year to make sure he is on the wait list, correct?
Absolutely, that's fantastic. And if you have a service coordinator, when they go out to do their renewal person-directed plan, they complete that contact.
Mhm.
That's also a good way to make sure that you remain on the wait list.
And you know, as parents, we have to be proactive. We have to be. We do our best to help our parents and to educate them, but parents have got to be proactive as well, and this is part of that. So another.
I do want to add that here at the Harris Center, our team is very involved. So if they don't reach you, they're not just going to take you off the list. They'll send a certified letter, they'll reach out. So of course you want to be proactive, but we also take additional steps as well.
No, I understand. So another question is the Texas home living, and you may have to have us copy and paste that and ask someone, is Texas home living aimed for younger people hypothetically? For example, it would make more sense for children, young adults to be on that before they opt for residential to move out of the home.
Okay. So Texas home living is really just aimed at integrated living. So it's a way to make sure that individuals are receiving services to prevent institutionalization, right? Yeah. So many years ago, there weren't services, and so individuals would end up institutionalized at a state school. And so these waivers were created as a way to provide support so that the individuals could remain in the community. So, yeah.
Yeah, okay. You don't actually have to already have Medicaid. That comment may keep people from getting on the list. My child became Medicaid eligible once he was qualified for the waiver.
Okay.
So,
yes. So my point was really in saying that eventually you will need to qualify for Medicaid. Exactly. Because Medicaid is what funds the program.
Exactly.
So if you cannot qualify for Medicaid, then you cannot get in the program. So thank you for that clarification. And again, get on the wait list because when that time happens, we have those conversations and we say, well, you don't have Medicaid, but let's apply. So we walk you through that process. So.
Yeah, absolutely. And keep in mind that when you apply for SSI, when your loved one turns 18, once you are granted SSI, which stands for Supplemental Security Income, you automatically then are given Medicaid. So do know that. Is there a way we can get updates on the total wait list or where we stand in line? I already replied, yes, you can call the Harris Center and they will tell you.
They do one thing. So the state did start adding like where you are, like a number, but they don't give you the total. So it's hard to gauge. Yeah.
Right. Yeah. And I've asked for the total and they give it to me.
Okay, great.
Yeah, they will give it to me. So, just a general comment, and I know you've heard this before. I believe that LIDAs are like school districts. We're all doing the best we can with the limited resources that we have. If people want change, they need to reach out to their legislators and they need to demand it because that's how services improve. So one of the parents had made a comment, and I believe this, all of these programs sound amazing. They're fabulous. But when you hear the words interest list, wait list, I mean, that seems like an eternity for families. And that's what happens when you have agencies that are funded by the state. You are doing the best that you can.
And the way that it's written, so with our performance contract with the Health and Human Services Commission, as a LIDA, we are only required to provide 3 services: the completion of a DID, respite, and service coordination. Those are the only thing we are required to provide. However, the agency has the opportunity to offer other services. And so that's why they look different from LIDA to LIDA. But we do have finite funding, which greatly impacts our ability to serve, as many as we would like.
Another great question: when people call the Harris Center to get on the waiver of the interest list, does someone tell them about the other services that the Harris Center has to offer? I think the answer to that is no, but I could be wrong. I think you have to ask and you have to be proactive. So please correct me.
Yes. I would again go with the proactive take, because this presentation was a lot, right? We have different teams, and so we don't rely on them to talk about all the services because they're ever changing, and we don't want them to confuse families. Now, what they should say is that if you are interested in services, that they can direct you to our eligibility center to get that process started. But I will reach out to the program director of eligibility to kind of confirm what that process is, Judy, and I can send it to you.
That would be great. That would be great. So Minerva, you had a number of questions, and I had sent you an email that said, why don't we have a chat so that I can get all of your questions answered? Is that okay with you? Because your questions seem pretty extensive. So just let me know if that's okay.
Everything answered. It was just three questions that were remaining. I just put them on there.
Oh, I'm so sorry then. I apologize. So Minerva asked, my son has autism and he just turned 3 years old. When he turned 2 years old, I had the diagnosis and right away I signed him up. I got a letter from MHMR on his 3rd birthday confirming he is on the wait list for the following 2 programs, HCS and Texas Home Living. His ABA school told me I needed to do an IQ test now for this. Is that correct?
Okay. You want me to,
Sure.
So no, that is not correct. I mentioned earlier that you do not have to provide anything to demonstrate diagnostic eligibility when you sign up on the wait list. So yes.
Okay.
So that only happens
Now, if you,
active?
Minerva, can you speak up a little bit?
So the testing or psychological testing or IQ testing only happens, once he becomes eligible for the waiver?
no, if you are interested in receiving any of the services that we mentioned, that's when that diagnostic testing occurs. So because of the way that we're funded, we have to ensure that somebody meets the eligibility requirements. And so the assessment is for the waiver later on, but it's also to be able to access what we have now, like respite and things like that.
So Minerva, what I would do then is call and tell them that you would like your son to be evaluated by the Harris Center. They can then arrange for an appointment, and then they can discuss what services they can offer your son or daughter. Does that make sense?
Yes.
Okay. And then you were also told by Texas Children to call the numbers. There's no affiliation with them. I know what you're referring to. Texas Children's, which just wants to empower parents as well and make sure that they're calling the right list to make sure that their loved one is on that wait list.
Yes,
Okay. So
absolutely. And thank you for bringing that up. There are, like I mentioned, other programs, but the Harris Center doesn't oversee the enrollment into them. And so we don't, as Judy mentioned, there's really no affiliation between us and those programs. But of course, we recommend that families get on any list that would meet their needs.
If
My
you,
question is, if we were to move states, I know that.
yeah,
if we-
that's totally different, Minerva. And it really depends. Some states, the wait list is much, much shorter. Much shorter. Texas is probably anywhere between 48th to 50th on the list of weights. Sadly, we are not in a good state.
Yes.
And when people move here, they are shocked.
Ohio is pretty good. I'm just saying.
Ohio is pretty good. New York is pretty good. Massachusetts is pretty good. So if you're within Houston and vicinity, then that's okay. But it's when you move out of state, yes, you do have to register with them and find out what their wait list is.
Okay, so we start all over essentially.
Yes, but starting all over, depending on the state, could be a better move.
Okay,
It just depends on the state.
okay, got it. That's all I had. Everything else was answered.
Oh, okay, wonderful. I'm so happy. So another great question. How are community first choice services delivered? Would you be approved for a certain number of hours or time period? Is this in addition to other Medicaid programs you might be eligible for? So before you answer that, Ninfa, Kenyanika Johnson, who is the Community First Choice Coordinator, she will be joining us May 12th, and she's going to answer questions in depth. I'm happy to introduce you to her. So just let me know if you would like that. One of the things I wanted to mention on Community First Choice is that the managed care provider, in our case, it's AmeriGroup. The AmeriGroup provider and the Harris Center, our service coordinator, all meet either virtually or in person, depending on the pandemic. And a plan is created and hours are determined. Keep in mind that with Community First Choice, those hours can be in the home or in the community.
Thank you, Judy.
Yep. And if there's anything else you want to add to that, Marianne, has your son ever been evaluated by the Harris Center?
Yes, sorry.
Okay, so yeah, so if you want, email me and I'm happy to introduce you to Kenyanika.
Okay, wonderful.
Yeah, just email me and remind me.
Okay, super, thank you.
My pleasure. So Leslie had a great question at about 12:37, and Leslie, maybe you can chime in. What type of related conditions can you give a few examples for CFC?
Ask the question again, Judy. I'm
So
sorry.
for CFC, you mentioned that people can get Community First Choice. You mentioned, I think, autism, intellectual disability, and then you said other related conditions.
Right. So CFC has a component to it where it's not specific to IDD only, which is why I put that there. I will definitely have to rely on Kenyanika's expertise to explain those things. But just from my personal experience, I know that sometimes they others have qualified that I didn't think would, but because of the clause in that program, it's a little different. So make sure you have that question when she presents to kind of make sure she goes over that.
Okay. And then Mrs. Jefferson, hello. How are you? So please remind Frederick to email me if I haven't by the end of the day. He asked about families in Brazoria County, and they would be assigned to the Gulf Coast Center, which is on, I think it's on 45, that Emmett Parkway or something.
Mm-hmm.
And I'm happy to introduce him to my contacts there so that you all can pass those on for families in Brazoria County. Nita had asked, Nita, are you still on? What did you ask? Are they only for Harris County residents or can other counties participate too? Anita is gone. She probably had to leave. So I'm not sure what the answer, what that question was.
Okay.
So services like Dayhab and Respite are services you can get while waiting to come to the top of the waiver list?
Absolutely. Yeah.
Okay.
Absolutely. Absolutely.
What agency does the Harris Center use for respite care?
We had a contract with Kelly Sitting Services,
Mhm.
but I think that they're currently in discussions for continuing that contract. You know, due to COVID,
Sure.
there was changes there, but that's who we were using, Kelly Sitting Services. And then we also contract with Easter Seals
Right.
to handle the administrative function of authorizing services. And there's some training that providers have to do, and so they handle all that component.
Perfect. So Ninfa, could you type in your contact information in the chat box?
Sure.
People had asked for that as well.
I think that's it.
I think that was it. Oh my goodness. So I know that some of you joined late, some of you got kicked off the session, some of you had internet issues. So I will be sending a recording. I've learned how to do that actually. And I should be able to send it to you by tomorrow. And please make sure that you fill out the survey. And Ninfa's going to put her contact information in there. Did I miss any questions or any other questions that anyone
have a
thought of?
question.
Yes,
Have a minute?
Nicole.
Thank you for the invitation, by the way. I'm overwhelmed for all this information.
I know.
But thank you. I do appreciate it. You know, I love to pass down information to my fellow parents. But I have a question specifically for my son and my situation. So we have Medicaid through Texas Children's, but we also have private insurance through my husband's job. So that's a secondary insurance. If I want my son to be evaluated on the Harris Center, they're gonna go based on the Medicaid cost, or they're gonna go based on our income or in the insurance. It's so confusing.
Yes, it is absolutely confusing. In terms of the DID, there is no charge for that. So you don't have to worry about that piece. They do look at income in terms of whether there is a monthly ability to pay for services. So that's done in that intake assessment. So once you get the DID and you go through that intake, you don't have to worry about any paying of anything, right? So we serve individuals with Medicaid and non-Medicaid, citizens, non-citizens.
Right.
So once that happens at that intake, you will know then if you will have to pay for services moving forward.
But the evaluation is free.
That is correct.
Oh,
You-
that was my question.
That is correct.
Okay.
You do not have to pay for any of that. And then at the end of that meeting, they'll tell you if you want to do services, you will or won't pay.
Oh, okay. Thank you. That definitely answered my questions. I appreciate it.
Of course, if you have
Wonderful.
anything else, please feel free to email me.
Hi, Leslie.
Hey, Ninfa, did you just say it's okay, y'all will provide services to non-citizens?
That is correct. That is correct.
Awesome.
Yes.
Yes, I do. I send them all the time,
Yes. Yes.
all the time.
Citizenship does not matter. You know, in the allocation that we receive from Harris Health or the Harris Health and Human Services Commission, part of that funding is to be able to cover services for those that do not have Medicaid.
Mhm.
Awesome.
Well, my brain is swimming. I don't know about anybody else's.
I think I'm ready for the gummy worms I purchased this morning.
I should have dropped off dessert for you for today. Absolutely. So Lorena, thank you. Yes, you can always look to our website, familytofamilynetwork.org. I try to email everyone with upcoming programs and everything, but sometimes the schedule gets a little overwhelming. So please know that you can check our website. You can also check Facebook.
Facebook, yeah.
Family to Family Network is on Facebook. So please, please know that we try to give out as much information as possible. But again, this falls under the proactive part. Kind of call us, email us. Do we have monthly sessions? So for this particular series, it's every other Wednesday.
Mhm.
So the next one will be February 20th. And right now I have presenters booked through July. And I am working on more because there is so much to educate people on.
Next,
And
excuse me, it's February 17th.
why,
Wednesday.
thank you, Christina. See, one of the many reasons I love Christina, she's able to, you know, she's younger than me. She's more with it. So yes, February 17th. Why did I come up with February 20th?
Leslie, I think she has another question.
Yes, and because February 20th, we're having our leadership and advocacy classes. So, so that's why I thought the 20th. I have too much going on, do you think? So Leslie, what other question do you have? You asked great
I
questions.
just wanted to mention to everybody about our monthly Zoom support group
Thank you,
meetings.
Leslie. Another great reason I love working with Leslie.
Because we can answer some specific questions on those too. And you
Yes.
can always call me too.
Yes. So Leslie had a really great point. And Minerva, Leslie, or Christina, did you see Minerva's note in there about her husband's email? Can we place her husband on the email list? Could you take note of that for me, please? Thank you so much. So yeah, our support groups are once a month. Well, they're every Monday, and every Monday there is a different category of age groups. So the first Monday of the month is
Adults.
adults. The second Monday of the month is Spanish speaking families run by Christina. Thank God that's not run by me. The third Monday of the month, I believe, is me, and I handle, I know Nicole is laughing. I have to laugh at myself, Nicole, you know? The third Monday of the month is me, and I do
Middle
families,
school and high school.
kids, that's right, are middle school and high school. And then the fourth Monday of the month is preschool.
Preschool and
Yes,
elementary.
and elementary school, and that's run by our executive director, Mary Jane Williams. To find out more about the parent groups, look on Facebook at the Family to Family Network page, or look at our website, family2familynetwork.org, and that's TO spelled out in Family to Family Network. So so happy that you all joined us. I'm thrilled you found it so helpful. I know I do. And I could hear this 8 times and I would still have questions because it's a lot of information. So thank you all for your questions. If there isn't any more, I'm going to conclude this meeting. So happy. And thank you.
Please
Thank
fill out
you.
our survey.
Yes, fill out that survey. Absolutely fill out the survey. So thank you all so much for joining us. Have a great rest of the day. It is beautiful outside. Thank you. Thank you.
Thank you, Ninfa.
Thank you, ladies. Thank you, everyone.
Ninfa,
Bye-bye.
Leslie, and Christina, could you stay on for 1 second?
Sure thing.
Thank you. Thank you so much for completing the survey. Okay, so we have 2 more people to log off.
Yeah, they might be away from their screen.